CEN Exam Tips Video. Question 1. A patient with a history of depression arrives after ingesting an unknown quantity of acetaminophen. The nurse anticipates activated charcoal, N-acetylcysteine, sodium bicarbonate, flumazenol. Question 2. A patient with a history of asthma presents with respiratory distress, minimal air movement, and an absent wheeze. This finding indicates the patient is improving. A silent chest, indicating severe bronchospasm. A pneumothorax. The patient needs a bronchodilator. Question 3. A patient presents with acute onset of tearing chest pain radiating to the back, along with a blood pressure difference of 30 millimeters of mercury between arms. The nurse suspects acute myocardial infarction, aortic dissection, pulmonary embolism, pericarditis. Question 4. A patient involved in a high-speed motor vehicle collision presents with hypotension, abdominal distension, and a positive FAST exam. The nurse anticipates emergent CT scan, immediate laparotomy, observation in the ED, administration of vasopressors. Question 5. A previously healthy patient presents with acute onset of shortness of breath, hypoxia, and normal chest X-ray. The nurse's primary differential diagnosis is pulmonary embolism, asthma, pneumothorax, myocardial infarction. Question 6. A patient with chest pain has a 12-lead ECG showing a new onset left bundle branch block. The emergency nurse should prepare the patient for a stress test, immediate transfer to a medical surgical floor, coronary angiography, observation for 6 hours. Question 7. A patient with a history of sickle cell disease presents with severe back and chest pain. The nurse suspects musculoskeletal strain, vaso-occlusive crisis, pulmonary embolism, myocardial infarction. Question 8. A patient presents with urticaria, angioedema, and difficulty breathing after receiving 4 contrast dye. The nurse's priority is to administer diphenhydramine, administer epinephrine, start in 4, call a code. Question 9. A patient taking sildenafil, Viagra, 2 hours ago now presents with chest pain. Which medication is contraindicated? Aspirin, nitroglycerin, morphine, atorvastatin. Question 10. A patient presents with right upper quadrant pain radiating to the shoulder, fever, and jaundice. The nurse suspects acute pancreatitis, acute cholecystitis, bowel obstruction, perforated peptic ulcer. Question 11. A patient presents with a sickle cell crisis and reports severe pain. The nurse should encourage oral fluid intake, administer a non-steroidal anti-inflammatory drug, administer opioids as ordered, apply a cold compress to the area. Question 12. A patient presents with sudden onset of severe, diffuse abdominal pain, vomiting, and a history of alcohol use disorder. The nurse anticipates an order for NG tube placement, serum amylase and lipase, abdominal CT, all of the above. Question 13. A patient presents with sudden onset pleuritic chest pain and shortness of breath after a long flight. The nurse's priority is to assess for myocardial infarction, pulmonary embolism, pneumothorax, asthma exacerbation. Question 14. A 64-year-old male presents with crushing substernal chest pain radiating to his jaw and left arm. He is diaphoretic and nauseated. His ECG shows ST segment elevation in leads V1, V4. The nurse anticipates an order for aspirin 324 milligrams chewable, morphine sulfate 4 milligrams for push, nitroglycerin 0.4 milligrams sublingual. All of the above. Question 15. A family member of a patient in cardiac arrest insists that everything be done to save the patient, despite the patient's living while declining aggressive measures. The nurse should follow the family's wishes, continue CPR until the physician clarifies the advanced directive, stop CPR immediately and contact risk management, ask the patient what they want. Question 16. A patient presents with descending paralysis and areflexia following a recent viral illness. The nurse suspects Guillain-Barré syndrome, multiple sclerosis, myasthenia gravis, stroke. Question 17. A newborn with meconium-stained amniotic fluid is delivered. The nurse should suction the mouth and nose immediately, dry and stimulate the infant, perform a brief assessment and begin ventilation if needed, intubate and suction the trachea. Question 18. The nurse is performing a secondary assessment on a trauma patient and notes a GCS of 12, a respiratory rate of 30, and an SpO2 of 89% on room air. The nurse should apply oxygen and prepare for intubation. Complete the secondary survey before intervening. Place the patient in a high Fowler's position. Administer naloxone. Question 19. A patient presents with confusion, nausea, and a fruity breath odor. The nurse suspects diabetic ketoacidosis. The priority is to administer insulin, establish 4-access and begin fluid resuscitation, obtain a serum glucose, administer sodium bicarbonate. Question 20. A patient with known borderline personality disorder presents with superficial wrist lacerations. The nurse's priority is providing emotional support, suturing the wounds, assessing for suicide intent, discharging the patient home,